Hey viewers, welcome to our presentation covering the topic of the Tuskegee syphilis experiment. In this video essay, we're walking through what syphilis is on the biological level, how the disease and its treatment evolved historically, and how all of that ties into one of the most infamous studies in the U.S. medical history. So, to understand why the Tuskegee experiment was so harmful, we need to start with the basics. What syphilis actually is. Syphilis was caused by a bacterium called Treponema pallidum. It is a really thin corkscrew-shaped organism, what we call a spirochete. Because of this spiral shape and its internal flagella, it moves in a twisting, drilling motion that helps it get through tissues and spread in the body. The infection usually spreads through sexual contact or contact with broken skin or mucous membranes. It moves in stages, starting with a small sore, then a full body rash, then sometimes lying dormant for years, and finally damaging organs like the heart, brain, nerves, or bones. Without treatment, it can even pass from mother to baby. So, syphilis has been around for centuries. There's still debate about where it came from originally, but we know it exploded across Europe in the late 1400s. Before antibiotics existed, treatment options were honestly dangerous. People were given toxic substances like mercury or arsenic, which often caused more harm than help. On top of that, the disease came with a lot of stigma, especially around the idea of bad blood, which communities used to describe a mix of illnesses, including syphilis. Public health efforts at the time focused on isolation and screening, but without effective medicine, the outcomes were still grim. Everything changed with penicillin. In 1928, Alexander Fleming noticed a mold. Penicillin killed bacteria on a petri dish. It took years for other scientists like Florey and Jane to turn that discovery into the first mass-produced antibiotic in the early 1940s. Penicillin works by blocking bacteria's ability to build a cell wall, which causes the microbe to burst and die. By around 1943, penicillin had become the gold standard cure for syphilis, fast, safe, and incredibly effective. This is important because by the time penicillin was widely available, researchers absolutely knew syphilis was treatable, which brings us to Tuskegee. The Tuskegee syphilis study, officially called the Untreated Syphilis Study at Tuskegee, was carried out by the U.S. Public Health Service from 1933 to 1972 in Macon County, Alabama. Researchers recruited 600 black men, 399 who had syphilis and 200 who didn't, by telling them they were being treated for, quote-unquote, bad blood. In reality, the real purpose was to watch what syphilis did to the human body if it was left untreated. The study was supposed to last 6 months. Instead, it went on for 40 years. The participants were mostly poor, rural black men, many who had little access to healthcare. They were promised free exams, free meals, and even burial insurance, which made the study feel like a lifeline. But they were never told they had syphilis. They were never asked for informed consent, and once penicillin became the standard treatment, researchers made sure the men didn't receive it. Not even from other clinics or programs. The consequences were devastating. Many men died from syphilis or complications of it. Some infected their partners, and some children were born with congenital syphilis, all because a life-saving treatment was withheld. The experiment finally ended in 1972 after being exposed to the public, creating national outrage. Tuskegee wasn't just unethical, it broke almost every rule we now consider basic in human research. There was no informed consent. Treatment was intentionally denied after a cure existed. The study targeted a vulnerable population with little power to speak up, and the data collected was valued more than the lives of the participants. Socially, Tuskegee had massive consequences. It damaged trust in healthcare among African American communities, and that mistrust still shows up today in how people view medical research, vaccines, and the healthcare system overall. The public outcry from Tuskegee helped lead major reforms, including the creation of institutional review boards, or IRBs, which are now required for any research involving human participants. When you connect the biological facts to the ethical issues, the picture becomes even clearer. Syphilis is curable. We know exactly how the bacterium works and how penicillin stops it. So, the decision to not treat people wasn't an accident or misunderstanding. It was a conscious choice that violated scientific responsibility and basic human rights. For nursing and healthcare today, this is a reminder that understanding the disease is only part of the job. We also have to respect patient autonomy, provide truthful information, advocate for fair treatment, and be aware of historical trauma that still affects certain communities' interactions with healthcare. Tuskegee teaches us the importance of constant vigilance in research ethics, especially when working with marginalized or vulnerable groups. Syphilis still exists today, and early testing and treatment are crucial. Nurses play a major role in educating patients, building trust, and advocating for care that is culturally sensitive and equitable. And we also have to recognize that the legacy of studies like the Tuskegee experiment contributes to real disparities today. People remember history, and healthcare professionals need to understand that trust must be earned and not assumed. Understanding the microbiology is important, but understanding the people and how science impacts them is what strengthens our work in nursing and healthcare and shapes our learning in microbiology. We have reached the end of our video essay. Thank you so much for watching our presentation.